Agony in Europe tonight as Italy's death toll passes 10,000. A day after another morbid milestone, 919 dead on Friday.
The United States surpassed Italy on Saturday to become the country with the highest number of recorded coronavirus deaths, reporting nearly 20,000 fatalities since the outbreak began, according to a Reuters tally.
Professor Grasselli, what is the situation in Lombardy today?
Well, the situation is critical because we have a huge number of patients currently being treated in the ICU and in our hospitals. I know the situation of the ICUs very well since I am coordinating the network of COVID-19 ICUs. We now have around 600 patients being treated in the ICU in about 50-55 dedicated ICUs. And we have treated a total of more than 700 patients from the beginning of the epidemics. So if you think that in Lombardy, the total number of ICU beds was about 800, 850, something like that, before the crisis, you can understand that it's an incredible stress for the system.
What is the age range that you are dealing with?
The median age of the patients admitted to the ICU is 65 years. This means that half of the patients are older than 65 and half are younger than 65. In the last 7 days, we are seeing an increase in young people. A 20-year-old boy who was intubated 2 days ago.
What about children?
So, children, we have 3 or 4 neonates, I think, who tested positive and who have not so severe disease. And children, as in China, are basically spared, at least from the symptoms. I'm not sure that they are not infected, but apparently they don't get sick.
To COVID-19, ground zero. Was there a cover-up? From the wet market all the way to government, her shocking story. When it really began.
The authorities in Wuhan haven't been honest with the world.
There has been cover-up.
A Sky News Australia special.
Factories are back up and running. And construction workers are back on site. Life, it seems, is returning to normal at the birthplace of COVID-19. The lockdown of Wuhan in China has been loosened. It'll be lifted on Wednesday, and authorities there are celebrating what they see as their successful battle against the deadly virus. But we're now learning just how irresponsible they've been. The cover-ups and the apparent disregard for human life, which may have led to the deaths of thousands of people.
We could have been better off if China had been more forthcoming.
The virus, now known as COVID-19, was believed to have originated in this Wuhan exotic animal market, transmitted from a bat to a human. It spread like wildfire. Hundreds were infected within days. Doctors who tried to alert authorities were harassed and ignored. Some have even disappeared. The Chinese government claims the first coronavirus case was identified around December 31. But official documents indicate that's an outright lie.
From the classified government record that we have seen, what we have found is that there are actually cases in November.
Investigative reporter Josephine Ma says the classified documents she's seen state Chinese authorities knew of a case of an infected 55-year-old from Hubei province on November 17. That's 6.5 weeks before Chinese Communist Party leaders alerted the World Health Organization.
before 20th of January, I mean, there was like cover up, of course. From the information we saw, like in 2019, I mean, there were already like over 200 cases.
The infamous lockdown of Wuhan then came much too late. The horse had already bolted. The virus surely would have spread beyond the city of 11 million and likely beyond China's borders.
Tonight, 52-year-old Kevin Raffle in a coma fighting for his life against COVID-19. Doctors now trying a Hail Mary pass to save his life, a treatment called convalescent plasma, but not just any plasma. It has to come from a patient who survived coronavirus, has been better for 14 days, now tests negative with a compatible blood type. The treatment is still unproven. The idea is simple. Antibodies from a recovered patient can fight the disease in someone currently infected. Last month, the FDA approving the emergency use of plasma on a case-by-case basis for only critically ill patients.
I'm very hopeful. I felt in my gut, I felt it was an option that we had to explore.
This plasma treatment that worked with the Spanish flu is now in clinical trials. 300 people have received it nationwide.